Hi, my name is Maria Cruz, and I'm going to be your nurse today. I'm going to be doing a head-to-toe assessment. Is that okay?
Yes.
Okay. Can you please tell me your name and date of birth?
21 January 11, 72.
Okay. I'll check your ID. 21 January 11, 1972. Okay. Do you have any allergies?
Penicillin.
Okay. Do you know where you're at?
Hospital.
Do you know where you're here?
Head-to-toe assessment.
Okay. Do you know today's date?
January 11, 2021.
Okay, so patient is oriented ×4. You were allergic to penicillin. Do you know what happens with penicillin? Okay, so the patient looks pleasant and well groomed. Do you have any pain?
No.
From 0 to 10 level?
0.
0, no pain. Okay, so I'm gonna check your head. The head looks symmetrical. There are no bruises or bumps. The hairline is symmetrical or well distributed, I guess. And the skin is dry and warm. I'm gonna check the ears, and the ears look normal. There's no drainage, no swelling bilateral. I'm gonna check the nose and the mouth. Okay, so the nostrils are pink bilateral. The septum is intact, and oral mucosa is pink and moist, and no swelling in the tonsils. I'm gonna palpate the trachea, and the trachea is midline. The range of motion is without distress. The thyroid is soft and smooth, symmetrical, non-tender. The lymph nodes, I'm gonna palpate the lymph nodes, and the pre-auricular, the posterior auricular, the submandibular, the submental, the superficial cervical, and the deep cervical, and the supra clavicular. No lymph nodes palpable. I'm gonna auscultate for the carotid arteries, and there are no brute sounds. I'm gonna palpate the carotid and the apical poles, and they are equal bilateral. Can you please turn to the left? I'm gonna check for the JVD, and there is no jugular vein distension. The central venous pressure is as expected. I'm gonna check the cranial nerve number 1, which is the sense of smell. Can you smell for me?
Alcohol.
Okay, and the cranial nerve number 1 is intact. I'm gonna check for the vision. So there's not sure what's done before. Your vision is 20/20. Do you use glasses or contacts? No. Okay, so cranial nerve number 2 is intact. I'm gonna check the cranial nerve number 3, 4, and 6, which is the perla. And can you please look at the line? Okay. So the pupils are equal, round, and reactive to light and accommodation bilateral. I'm gonna check the 6 fields of gaze, which is nerve 3, 4, and 6. Please follow the line. Okay. The nerves are intact, 3, 4, and 6. And I'm gonna check for the facial nerve for if there's any if the cranial number 6 and 7 are intact. So with the little paper, can you please tell me if you feel?
Yes.
Okay.
Yes.
Okay.
Yes. Yes.
Okay.
Yes.
Okay. So can you let me know if you have any changes in taste? Have you had any changes in taste?
No.
Okay. Can you raise your eyebrows? Okay. Can you smile for me? Okay. And can you puff your cheeks? Okay. So cranial number 5 and 7 are intact. Oh, the jaw pushed down. Okay. And the jaw range of motion is normal. I'm gonna perform the whisper test. So let me know if you hear something.
Tony.
Okay.
Tony.
Okay. So also stand up and close your eyes. And don't move. Okay. Okay. Now open your eyes. Okay. Sit down. Okay. So cranial nerve number 8 is intact. I'm gonna check cranial nerve number 9, 10, 11, and 12. Are you able to swallow? Okay, so you can swallow. Can you stick your tongue out? Okay, move it to the sides. Okay, can you push my hands? Okay. Can you move your head to the side? Okay, so cranial number 9, 10, 11, and 12 are intact. I'm gonna check the gait for balance. So stand up and walk for me. Wait, just move. Okay, walk. Okay, fine. Sit down. Okay, so the gait is normal and expected for each. I'm gonna assess the upper cerebellar and the lower cerebellar. So can you do this as fast as you can? Okay, can you touch your feet, your chin with your foot and the other side? Okay, so the cerebellar is intact. I'm gonna check the arms for integrity and any signs of abnormality. So there are no bruises or scars, no edema, no breakdowns in both arms. The skin is warm and dry. I'm gonna check the skin, so I'm gonna pull a little bit. Okay, so there's no dehydration. And I'm gonna check for the symmetry of the chest. So the chest is symmetrical. There's equal expansion. The respiration are equal and unlabored. I'm gonna assess the brachial and radial pulses. Okay, so the brachial pulses are equal bilateral, 3+ equal bilateral, and the radial pulses are 3+ equal bilateral. Okay, so I'm gonna check your range of motion and strength. So can you extend your arms and rotate? Can you flex your arms? Okay, can you you already rotated, flex? Okay, can you rotate? Can you rotate your wrist? Okay, so push. Okay, fine, that's it. There's a full active range of motion. The strength is normal, bilateral. I'm gonna assess the tendon for reflexes, and I'm gonna check. Okay. Okay. Okay, so the reflexes are normal. I'm gonna check the capillary refills. Okay. Okay, so the capillary refills are less than 3, which is normal. I'm gonna auscultate the heart and lung sounds. So the heart, I'm gonna start at the aortic valve, which is in the second intercostal space left sternal border, the S2 is greater than the S1. The pulmonic is on the third intercostal space, the left sternal border. The S2 is greater than the S1. The Erb's point, which is in the third intercostal space, left sternal border, the S1 and S2 are equal. The tricuspid valve, which is in the fourth intercostal space, left sternal border, S1 is greater than the S2. And the last one is the mitral, which is the fifth intercostal space, left mid-clavicular line. And the S2 is greater than the, no, S1 is greater than the S2. Okay, so I'm gonna auscultate the apical heart. Lean forward. Okay. And I auscultate for a full minute, and the pulse rate is 65, expected for age. I'm gonna auscultate for the lung sounds. And so I do the posterior lung sounds. Take a deep breath. Okay, deep breath. Okay, deep breath. Okay, okay. Now the lateral breath and the other side. Okay, and the anterior. Take a deep breath. Okay, good. Okay, so lung sounds are clear with no adventitious sounds. I'm gonna check the abdomen. Have you had, when was your last bowel movement?
Today.
Today, okay. And do you know the color of the bowel movement?
Brown.
Okay, and do you?
Solid.
Okay, so it was solid. And the color was, what color was it?
Brown.
Okay. And when was the last time that you urinated?
Today.
And what color was it?
Clear.
Okay. And did it hurt?
No.
When you urinated? Okay. Was there any odor?
No.
Okay. So I'm gonna inspect the abdomen, and there are no bruises, no scars, and the skin is warm and dry. I'm gonna auscultate for sounds. And I start at the right lower quadrant. And then the right upper quadrant, the left the left upper quadrant, and the left lower quadrant. And the sounds are normal active. I'm gonna percuss and palpate. Does this hurt?
No. No. No.
Okay. So there's no excessive fluid, and there is no masses, no tenderness. I'm gonna also check for the lower extremities, and the legs look no bruises, no lesions, no scars. There's no edema, there's no peeling, there's no tainting. I'm gonna check the capillary refills, just for the camera. I'm just doing it for the camera, okay? The capillary refills are less than 3, which is normal, bilateral, okay? And the flexibility and the range of motion, move your leg to the side, flex your leg to the knee, okay, the other side, okay, push my hands up, push my hands down, okay, so there's full range of motion. The strength is normal as expected for age. What else am I missing? Oh, reflexes. Okay, so the reflexes are normal, and I think I completed my head to toe assessment. Actually, I also need to check the pulses, the posterior tibialis pulses, +3 bilateral, and the dorsalis pedis, +3 bilateral. Do you have any questions?
No.
Okay, and I'm gonna give you the hotline. If you need any help, just call. Thank you.